how do sexual disorders develop in young people and how do they progress? Let us talk about this topic in this video. I am Dr. Praveen Tripathi. I am a consultant psychiatrist and sexual disorder specialist. And very often I see young patients who come to my clinic. They are in their teenagers or early 20s. They are fit, healthy. They don't have any medical history. Don't have high blood pressure. They don't have diabetes. They don't smoke. They don't consume alcohol. Everything is good. But still they present with symptoms of erectile dysfunction. They say that the erection is not happening. And in most of the cases, when I take history in details, the same pattern emerges. What is the story? Usually it's a young guy, as I said, teenager or early 20s, who tries to get intimate with his girlfriend physically for the first time, and he is not able to get a good erection on the first occasion. He gets anxious about it. He gets worried that why didn't it happen. He comes back home and starts looking for the solution or for the reasons. He comes across various YouTube videos, comes across certain articles, and he finds certain points or information which is misleading. The internet is full of videos which claim that because of masturbation the nerves get damaged or the blood vessels get damaged, and that is responsible or that causes erectile dysfunction. So when this young guy reads that or watches that video, he becomes even more anxious. He becomes afraid. He starts thinking that he has also been doing masturbation for many years, and in all likelihood his nerves also got damaged, and that is why he developed this problem. This thought comes in his mind. Then he somehow tries to calm himself down. Again, after some days, tries to have sex with the girlfriend for the second time. And this time what happens, during the act, while getting intimate with his girlfriend, rather than focusing on the girlfriend, the entire focus of this person goes on his own body. His mind is always focused towards his own erection, whether the erection is happening properly or not, is it adequate or not. And what happens is, if you're focused on a partner, you get sexually excited. If you get sexually excited, the erection is good. But if you're focused on your own body, if you're anxious, if you're worried about what is going to happen, the anxiety kills the erection. So this guy is worried, is focusing on his own body. That leads to a diminished erection, diminished blood flow, and the second time also is not able to have a good intercourse. Comes back home. Now his worry reaches another level. He is extremely worried that there is something really bad has happened to him, and that he is in trouble. He looks he searches more on the internet, watches more videos, and then he starts coming across the videos which tell about the morning erection. The videos tell him that if the morning erection is good, the morning wood is good, the body is doing fine. What videos do not tell is that if a person is anxious or depressed or under stress, the morning erection also takes a hit. The morning erection may, in fact, there may be no morning erection if a person is not in a good frame of mind, or if a person is anxious or depressed. Now this guy who is quite anxious or depressed tries to see his morning erection, tries to evaluate his morning erection, and he finds out that the morning erection is not as good. Now that further multiplies his worries. And now this guy decides to meet a professional. The problem with the sexual medicine is that this field is full of quacks, unqualified people who are making absurd claims, saying absurd things, but they are everywhere. So this guy also falls in trap of one such professional. He goes to that professional. The professional tells him first of all that masturbation is really bad. It can cause all sort of problems. Sometimes the professional also examines his penis, and just by looking at his penis, he says the nerves are damaged or the blood vessels are damaged, most likely because of the masturbation. And he makes the person even more afraid, and he gives some kind of herbal medication or some kind of treatment which is usually not proper medical treatment, not scientific treatment, and the person takes the treatment and comes back home. Now in this entire story, what needs to be understood is this guy did not have any problem to start with. He just did not have enough information about how sex happens, what is the physiology, what is the physiological process involved in the sexual activity. So when you start with your sexual life, when you have sex for the first time, your mind has two types of competing emotions, two types of conflicting emotions. One is of excitement. You're excited of becoming sexually active. That excitement helps you with the erection. But then there is another emotion of anxiety, the thought that how would it go? Would I be able to perform properly or not? What would the girlfriend think? So that anxiety emotion kills the erection. So these two emotions, conflict, they kind of, fight with each other, and if the anxiety wins, the person would not have a good erection. And then the cycle, repeats itself. The more there is anxiety, the lesser is the erection. The lesser is the erection, the more there is, the more the anxiety develops, and the person kind of gets trapped into this vicious circle. Had this guy gone to a proper doctor, proper medical professional, a MBBS, MD doctor, or MS doctor, the doctor would have told him that these problems once in a while happens to anybody. They can happen to everybody. It's no big deal. You don't call it erectile dysfunction unless it is there for more than 6 months. Had this person gone to a proper doctor, the professional would have told him this. But this guy went to a quack, and the quack gave him all the nonsensical information or non-medical information, which further complicated his anxiety, which further complicated his problem. So it must be remembered that in case you are having any sexual issue, first of all, understand what is normal and what is abnormal. And still, if you continue to have a particular problem, it's always better to go and see a medical professional, get yourself tested, take proper medications, and resolve the problem. So friends, this whole platform of MeSolves has been created for this purpose only. The team of doctors at MeSolves specializes in giving consultation on sexual problems, treatment of sexual problems, and if you are having any such issue, you please feel free to contact the MeSolves team. Thank you. All the best.